Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More states resume second phase of vaccination as Governor of Taraba State receives second jab of Oxford AstraZeneca vaccine. And Nigeria Center for Disease Control reviews epidemiological report as country records 203 cases and 28 new deaths. And it's zero daily COVID deaths announced in the United Kingdom for the first time since the pandemic began. And after one death was recorded last week in a single day, the Nigeria Center for Disease Control, NCDC, has reported 28 deaths from the coronavirus in the country. The new fatality figure overturns the previous record of 27 deaths recorded 30th of January 2021 and has now raised the country's death toll to 2,099 in total. Let's take a look.
It's been 6 days since the last casualty from COVID-19 complications was reported in Nigeria. However, the latest figures from the Nigeria Center for Disease Control shows that 28 deaths have been recorded in the last 24 hours, raising the fatality toll in Nigeria to 2,099. The agency also confirmed 203 infections reported from 5 states and the FCT in the last 24 hours. A leap in the daily single count of COVID-19 cases recorded in over 2 months. Benue tops the chart with 178 cases. Lagos, the epicenter of the disease, recorded 10 cases, while Ondo recorded 6. 4 cases were reported from Kaduna and the FCT, while Plateau recorded 1. The latest report includes 0 cases from Ekiti, Enugu, Kano, Nasarawa, Ogun, Osun, Oyo, Rivers, and Sokoto states, and a backlog of data from Benue and Nasarawa states recorded from February to May 2021. The new cases have raised the total number of confirmed cases in Nigeria to 166,518. Hospitalizations appears to have declined as over 2,000 persons have been discharged in the last 24 hours, increasing the number of discharge cases to 158,781. After vaccinating almost 100% of Nigeria's eligible population with the first dose of the Oxford AstraZeneca vaccine, the National Primary Healthcare Development Agency reports that over 73,000 Nigerians vaccinated with the first dose have received the second dose. Across the world, over 170 million cases have been reported, while the fatality toll has surpassed 3.5 million deaths.
Meanwhile, according to the weekly Epidemiological Report 32, Nigeria recorded more cases from previous week and more cases discharged. However, 1 death was registered and the case fatality rate dropped to 1.2%. Mrs. Elsie Laurie is the NCDC Head of Disease Surveillance Department. She joins us now to take a look at the virus trajectory in the country. Thank you for joining us on the program.
Thank you for having me. It's good to be here.
All right. I'd like us to begin, and this is before we talk about the last situation report, what we're seeing, especially the report from last night, the 203 new cases, quite a jump from the little over 30 that we had the following the previous day, and then we're also seeing 28 deaths in a single day.
Yes, that's quite unfortunate, but these cases are actually backlogs from previous weeks. We worked with the states because we noticed that some states have not been reporting, and so we called the states and we meet with the states regularly, but sometimes you find out that some states have, relaxed in terms of reporting. And so we had a meeting with the state and told them to look at their data and please give us the actual report. So yesterday's report was actually a backlog of some weeks since February, especially for Nasarawa. Nasarawa recorded, they did not give us a record of their deaths. They kept recording the cases. And unfortunately, we found out that the case managers where the cases were, being managed, and when there are deaths recorded, they were not related to the state epidemiology. So we had that gap, but we're working on that gap now to make sure that we do not have this kind of situation in our hands. But of course, we have to report it, and so that's what we have done. And the same thing goes for Benue State. Thank you.
So in terms of the monitoring, the surveillance, I mean, the NCDC has always said that states are responsible for this, for driving the awareness, for contact tracing, for testing. Are you saying that not much is being done at the subnational levels?
Not as we will expect them to do. A lot of states are doing very well. We have Lagos State doing very well and reporting all their cases and the deaths that they have recorded. But there are some states that are actually a little slow in catching up. And so such states, we monitor them regularly. If you remember at the beginning of the outbreak, we sent our teams to states to help to support the states in the response. So we've done that regularly. But of course, like you mentioned earlier, it's the responsibility of the states to do the active search for cases, do the testing, and also do the contact tracing. So, but we monitor them at the national level regularly. Thank you.
Finally, I mean, following the NCDC's last epidemiological reports, are we doing better in terms of controlling the pandemic?
Well, with the people not responding to the non-pharmaceutical interventions that are in place, well, we will say we are doing very well in quotes, but we need to be very careful because we have people coming in from some countries that have very high incidence and deaths, and they also have this variant of concern. And so we need to make sure that we take the necessary measures. We need to put the necessary measures in place. We need to protect ourselves. We need to take more responsibility. Looking at the cases, we know that other countries like India, there was a time we were praising India that they were doing very well, and suddenly they had events that blew up the number of cases for them. So we need to be very careful. So yes, we will say we're trying our best, but I'm not sure we're doing very well in terms of taking responsibility. And that's very key because each person needs to take responsibility. And what are these things? Put on your face mask when you're going out, especially when you're in crowded places. Make sure that you have this social distancing between yourself and the next person, about 2 meters. Wash your hands regularly. Use the sanitizer when there's no running tap available. So we need to do that for ourselves and take responsibility. Thank you.
Thank you, Mr. Elsie Laurie, NCDC Head of Disease Surveillance Department. Thank you for joining us on the program.
Thank you for having me.
The head of the World Health Organization has called for launching negotiations this year on an international treaty to boost pandemic preparedness as part of sweeping reforms envisioned by member states.
Thank you. The one recommendation that I believe will do most to strengthen both WHO and global health security is the recommendation of a treaty on pandemic preparedness and response. That could also improve, as I said earlier, the relationship between member states and fosters cooperation. This is an idea whose time has come. The safety of the world's people cannot rely solely on the goodwill of governments. Every government is responsible for and accountable to its own people. But member states can only truly keep their own people safe if they're accountable to each other at the global level.
Professor Titulola Obilade, Associate Professor, Public Health, NIA University, Abuja, joins us from Abuja studios. Thank you for joining us on the program. What's your take on the pandemic treaty being proposed by the WHO in light of the coronavirus pandemic?
Good evening, and thanks for having me, Millicent. I'll say it's a good proposal, But it tells us, first of all, what the enemy is, and that is the virus itself. We've had more than a year, like 18 months now, to know much more about the virus, and we've now also known the weaknesses of the countries. We have our G7 countries. Those countries were able to amass a lot of vaccines. I'm talking of something like, let's say, like Canada. You know, we had like 5 times what it actually needed. And then there were countries in Africa, the African nations, that didn't have enough. And then also, prior to that, we had a deficiency or what I'll call hoarding of information. You know, countries that had information, you know, on vaccines, they were kind of hoarding those the information we needed. So we've seen these programs coming up. But countries like the G7, you know, those 7 countries, in totality, the amount of wealth they carry, it's more than half of the rest of the world. So they are in a position of power, okay? And we have to look at ourselves, the rest, what I'll call the others, don't have so much power. And the global watchdog, WHO, does not have enough funds. That's why we have the COVAX. So it cannot do everything by itself. It needs the cooperation of all these countries, most especially the G7 countries, okay? Because they determine a lot of things, okay? Now, that aside, we also have to look at the rest of the world, the leadership in all the other countries. Look at the African countries that come into play, the instability in governance, okay, the insecurity in governance, the insecurity in the wars, civil wars. Those kind of instabilities kind of put the virus in a place where it can thrive, okay, because with instability comes poverty. With poverty comes a lot of poor infrastructure, health systems are weakened. And so when the pandemic strikes, it's almost impossible to tackle it. And we've seen that not only in African nations, but we've also seen it in other developing nations, other developing economies. So what the WHO has proposed is good in itself, but it also not only depends on human behavior, but it also depends on the leadership of different nations, especially the G7 nations. And then we're also looking at the tech giants. I'm talking about the big 4. You know, we're talking about the Amazon, Facebook, Google, and we're talking about Apple. You know, essentially, a lot of these tech companies have made so much money.
Just as we wrap up,
from what's going on.
Knowing that it won't be easy to implement such a treaty or agreement by all member countries, also seeing how previous treaties have gone in the past, what do you think Nigeria can learn from this? And this is essentially how we internally can prevent another pandemic.
Using the analogy of the virus being an unseen enemy, we've come to know what it is like within the past 18 months. So the lessons we have learned, is we've got to be prepared. The technology we need, the human resources we need, the logistics we need, and the money to make it all run. These are things we need to place on ground. It's not enough to say, okay, our health budget is never up to at par with what we need it to be. Okay, let's use what we have. Okay, and then you also want to come into play. You want to bring your primary health care into play. But most importantly, you need human resources. Then you need human behavior to change. Because what is driving the pandemic is human behavior. And to be able to change that human behavior, you need to educate them. Health education is important. If you are able to carry the people along, you're able to be transparent with them, you're able to communicate with them that this pandemic is not over. The treaty doesn't mean it's an end in itself. There can be other pandemics, there'll be other pandemics, but let the human behavior right now begin to be a way of change to prevent, or in case it does happen again, to kind of mitigate the effects of a future pandemic. And what human behaviors am I talking about? Social gatherings, sanitization, all these non-pharmaceutical methods, we need to let it become ingrained in us as part of our human behaviors, because those are things that can cause the spread. In addition, you also want to look at things like climate change, because looking at the origin of the viruses, we're thinking that, okay, it has something to do with human behavior interacting with the environment, okay? We'll talk about forests, the trees being cut down, and so we're looking at human interference, and then we're saying that perhaps the virus has jumped into the human. So those are things we've got to look at. We've got to really get
quite
to the
a lot
bottom
of
the
issues.
origin.
You're quite right, Professor Titilola Bilade.
Yes.
Wish we had more time, but we always appreciate your time, your insight into the issues. Thank you so much for joining us on the program.
Thank you for having me, Listen. Take care now.
Still to come, Governor Darius Ishaku received second jab of the AstraZeneca vaccine. We have that and more in a moment. Welcome back. The Taraba State Governor Darius Ishaku has urged residents of the state to embrace the COVID-19 vaccination to prevent getting exposed to the virus. The governor reiterates that the insinuations making the rounds on social media regarding the negative effects of the vaccine are false and should be disregarded by all. He was speaking shortly after taking his second jab of the Oxford AstraZeneca vaccine administered by his personal physician. He also adds that the availability of the vaccines does not mean an end to the adherence to the safety measures.
Today, I, as the governor, has taken my second dose of the COVID-19 vaccine, making it the final dose. I'm therefore by this calling on all Tarabans to go and take their first dose, those who have not taken it, and those who have taken their first dose should go for their second dose, so that they will be immune to this pandemic of COVID-19 virus. And I will still advise all Tarabians that we should still maintain the COVID-19 protocols, because we understand that COVID-19 is changing its faces every day, and therefore we have to also be careful, despite the vaccination, that we should not in any way contact the new variants that are coming into circulation.
Well, the swift vaccine rollout in some countries has led to a return to a near-normal life. In Israel, people no longer have to wear masks outside, while in the UAE, vaccinated football fans can now attend games and nightclubs have reopened. But elsewhere, countries that had effectively achieved herd immunity are seeing a third wave of cases. From Chile to Bahrain, figures are rising, and the coronavirus continues to kill an average of 10,000 per day worldwide. So what is really happening? Dr. John Oluwole joins us from the United Arab Emirates. He's a specialist neurologist at King's Hospital London in Dubai. Thank you for joining us on the program.
Thank you. Good evening.
Good evening. What's the situation in the UAE, and would you say the numbers have gone up or come down after the success being recorded in its vaccination program?
Well, the vaccination is really going on very well in UAE. People are turning out to have vaccine. So far, about 12 million doses have been given, and about 4 million people have been fully vaccinated. And we're already seeing the impact of the vaccination. The number of cases have gone down dramatically. I think at the peak of COVID-19 first wave, we reached up to 4,000, 5,000 cases per day. But now we're having just over 1,000 every day. So the number of cases have gone down dramatically, and we hope the numbers will continue to go down as people turn out to receive, more and more people get the vaccines.
But looking at the future, as a public health expert, I mean, regardless of the vaccines, are we looking at a situation where the disease continues for decades, for centuries?
Well, it's still very early to say that now. We still do not know for sure until the vaccination campaign is, completed across the world, and the number of cases are controlled, and we don't have new infections anymore. I think at that point we'll be able to say for sure whether we are in for a long haul or this is going to remit, and we may not have cases in the future. So it's difficult to say for now. I think we're just still learning from this virus. So it all depends on the virus, as Professor Fauci would say.
So the UAE's health ministry on Saturday approved the emergency use of a highly effective new treatment for COVID-19. We understand it's called sotrovimab. Tell us about the drug and its efficacy in the COVID-19 virus.
Right, sotrovimab is a monoclonal antibody, and what that means is it's a very, very highly specific antibody that is targeted at the virus, and it targets the spikes of the virus. So from the understanding we have so far, for the virus to be able to infect cells in the body, it needs to attach its spikes to those cells and gain entry into the cells. So this antibody is designed to block the spikes and stop the virus from gaining entry into the cells. And studies emanating from US and UK, spearheaded by GSK, has shown that this medication has the ability to reduce the severity of infection by up to 85%. So it's not intended to replace or compete with the vaccines. They do two different functions which are very, very important and not mutually exclusive. So the vaccines are meant to prevent infection or to protect us from getting infected in the first place, whereas sotrovimab is meant as a treatment. So if and when you get infected, the chances of you developing a severe form of the disease necessitating intensive care or very critical illness is reduced if you get this medication, sotrovimab.
All right, many thanks. Dr. John Oluwole from the UAE, specialist neurologist at the King's Hospital London in Dubai. Thanks, always a pleasure joining us.
Thank you so much.
Today marks the first day that the United Kingdom government announced no coronavirus deaths in every nation of the UK since the start of the pandemic. However, reports of daily deaths rise and fall throughout the week and are often lower immediately after weekends and bank holidays. We'll hear more on the global coronavirus update.
Peru has been among the hardest hit Latin America countries during the COVID-19 pandemic, with its hospitals overcrowded with patients and demand for oxygen outstripping availability. Experts had long warned that the true death toll was being undercounted in official statistics. The government says it is updating its death count in part because of a lack of testing that made it difficult to confirm whether a person had died to the virus or some other cause. India has reported 127,510 new COVID-19 cases over the past 24 hours to bring the country's total tally above 28.1 million, so says the Federal Health Ministry. The daily spike of new cases has been falling over the past couple of weeks, with the single-day registered cases falling to the lowest level in nearly 2 months. The country reported 2,797 deaths since Monday, bringing the total death toll to 331,895. Meanwhile, Indian doctors are now grappling to stem a rise in cases of mycomycosis, also known as black fungus, a fungal infection that causes blackening or discoloration over the nose, blurred or double vision, chest pain, breathing difficulties, and coughing of blood. It has been closely linked to diabetes and conditions that compromise the immune system. A new 2-week lockdown has come into force in Malaysia today as the Southeast Asian country battles its worst outbreak of the coronavirus since the start of the pandemic. Police set up roadblocks in the capital Kuala Lumpur and surrounding areas to screen for people travelling without permits as the new restrictions come into effect. Traffic also appears lighter in parts of the often congested capital.
Let's continue to take responsibility. Visit our website, channelstv.com, for more updates, also a better understanding of the pandemic. You can find several other stories there. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.